post-finasteride syndrome, fact or fiction. So there's people out there who've taken finasteride, which is called Propecia, which is to prevent male pattern baldness for many years, and when either during or when they stop after taking it, they feel loss of libido, depressed, anxious, insomnia, and loss of a sense of well-being, almost to the point where they can't function. Is that a product of finasteride, fact or fiction? Let me get into this. So I go back many years with this, and I've treated a lot of people who take testosterone. Why do I say that? People who've taken testosterone want to prevent certain aspects of testosterone use. They want the muscles, but they don't want the hair loss, the enlarged prostate, male pattern baldness, and body hair all over their body, except their head, hirsutism. So what did I give them? I gave them finasteride. What was the reason I gave them that? Finasteride, originally marketed as Proscar and then came out as minoxidil, because the company found, well, it prevents prostate enlargement and it prevents male pattern baldness. They found that it prevented male pattern baldness much later on. Okay, so I give it to these weightlifters because finasteride, which was either marketed as Proscar or minoxidil, prevents the breakdown of testosterone to 5-hydroxytestosterone. This is a breakdown product of testosterone. The enzyme involved is 5-alpha reductase, which prevents the conversion of testosterone to 5-hydroxytestosterone. Okay, so if you do that, 5-hydroxytestosterone is what's responsible for male pattern baldness, enlarged prostate, hair growth, and acne. So you can get rid of those 4 side effects of people who are taking testosterone, or in regular individuals, you can help them with enlarged prostate, male pattern baldness, I haven't heard, hirsutism, or acne. Okay, that sounds great. Here we have a drug, it can stop enlarged prostate, and it can stop male pattern baldness. So what's the problem? There's a whole industry built around male pattern baldness, enlarged prostate, because it virtually happens to all men. The enlarged prostate and the male pattern baldness is extremely common. So there's huge industries, the hair loss industry that prevent hair loss, or hair growth industry, whatever you want to call it, is huge. Very vested in this drug. Pharmaceutical industry, very vested in this drug. So everyone talks about this testosterone pathway. But that's not it. What you do have here is, in all men, we have progesterone. And this 5-alpha reductase that is blocked by finasteride, which is also called Proscar, brand name, and minoxidil, blocks the conversion of progesterone to pregnenolone and downstream isopregnenolone. Well, what does pregnenolone do? And isopregnenolone. And these other analogs of pregnenolone, what do? In the male body, also in the female body, but in this particular case, mostly men are using this drug, so I'm focusing on men because they're using for male pattern baldness or prostate enlargement. Well, turns out pregnenolone is responsible for, it's neuroprotective, it maintains the myelin sheath on neurons. You need that to insulate the nerve. It's neuroprotective. It is involved in neuroplasticity, meaning the connections between the neurons. It's involved with well-being, pregnenolone, isopregnenolone. It's involved in sleep. It's involved in anti-anxiety and depression. One of the key receptors that it's involved in is the GABA-A receptor, and I've talked about this in my GABA lecture, benzodiazepine lecture, sleep drug lecture. That GABA-A receptor is inhibitory. It's called GABA aminobutyric acid, is involved as an inhibitory neurotransmitter, a calming, soothing sense of well-being neurotransmitter. And guess what? That's what pregnenolone is responsible for. It's an allosteric modulator. I mean, it makes GABA more attractive and it makes it act more robustly at that receptor site. Okay, so now when you give this finasteride or Proscar, minoxidil for male pattern baldness, you are blocking the production of pregnenolone and isopregnenolone. They never talk about that. No one ever talks about that because most of the lectures you'll see are hair loss people, hair loss clinics, advertising on YouTube, blah, 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 blah. They don't want to talk about the problems, about how a neuropeptide that's critical for well-being, insomnia, sexual drive, anti-anxiety, anti-depression is being blocked. Now, why does it happen to some people and not other people? I'll tell you why. And everyone is a different genetic makeup, genotype. Everyone has a neurogenotype, so everyone responds differently to this. You give it 1 milligram, 5 milligram, 1 month, or 1 year, 5 years, 20 years. So yeah, the effects will vary radically because of dose, length of time, and the genotype you're dealing with. So a certain percent of the population, fact, will get post-finasteride syndrome. How could they not? You're blocking pregnenolone, you're blocking the body's normal mechanism to produce a neuropeptide that's essential for well-being, insomnia, anti-anxiety, sleep, sexual drive. Of course, these people aren't going to do well. And I'm guessing, the longer you're on this, the more damage you will have done. So it is a fact, this post-finasteride syndrome, and because we don't completely understand it right now, we're making these patients out to believe like they're histrionic or hysterical or making something up. No, this is real. How could it not happen is my opinion. Of course this is doing something. Absolutely. These people we need to address sleep, anxiety, well-being, depression. We need to look at their testosterone levels. I think we need to somehow figure out how to deal with lower pregnenolone levels and to reestablish them, or to figure out what damage blocking that over time has done. So there's more research here. And because the research isn't clear and it's a little unclear right now, it's a psychiatric problem. This is not a psychiatric problem. It has psychiatric symptoms, but you have affected neuropeptides in the body. And yes, post-finasteride syndrome is as real as a heart attack. And when people who say it's not, just upset me. So I get patients come in, do they think it's real? Of course I think it's real. Enough. And I'm tired of all these hair loss clinics, blah, blah, blah. They're all trying to portray that there's nothing wrong, that there's no problem. Yeah, convenient for them. It's self-serving for them because they've prescribed this for the past 20 years. And for them to say, now this is dangerous, makes them look pretty stupid, don't you think? And for my patients who have taken it, who are abusing testosterone and anabolic steroids, well, come on, you knew. You knew you were taking risks. But the people who were taking it for hair loss or for a large prostate did not know they were taking risks. They were taking it under instruction of their doctor, and they didn't know that they were going to get this post-finasteride syndrome. You know, I'm going to write some blogs on this, so stay tuned. You just follow my blog at dragresti.com. Just go to the blog on the toolbar. And please, I appreciate people like, subscribe, and buy my book on Amazon.com. Thank you, Dr. Mark Agresti.